vet appropriately and place the appropriate caveats on the studies as they come out. There's no other source that I can think of that I would say the lay public can reliably access. There's a scientific site called the Alzheimer Forum that's also very good, but it's more a dialogue amongst scientists, and we use all kinds of words that even I don't understand half the time.
So is there, but didn't you, Todd, mention something that you can get into the internet and get your publication?
Well, the Alzheimer's, I think the Alzheimer's Association website is the best for having, not only do they collate information internally, but they also bring in things like the Alzheimer's World Report, and every year this is published that talks about the changing demographics, the changing costs, and I think it's most accessible to the lay, and again, they're very conservative, I think, in terms of what they're, it's been heavily vetted by the time it gets there, so it's a balanced opinion.
Okay.
What are some things that you'd like to see Memory Garden, skilled nursing facilities do as far as examples go, as far as care?
Well, I think an awful lot of what they're doing right now ascribes to some of the principles that I was talking about activity. So my understanding and my observations lead me to believe that most of the residents are engaged in a regular set of both physical as well as cognitive activities. There are specific activities or specific schedules for socialization. The family is very strongly involved, and things like that. One of the things that we're doing at the University of Florida is trying to incorporate interactive video games into the activity schedule. So, for example, we're looking right now at the effects of doing simple Wii type activities, Wii bowling and Wii Fit in particular, on cognitive functioning. And for those of you older folks who says, "Oh, I'm not going to do any of that kind of garbage," it actually turns out to be extremely the most popular thing that the folks that we see engage in is the Wii Fit. And some preliminary data suggests that it actually positively influences memory recall after about a 6-week program. So engaging technologies, I think, is something that we have a lot to learn about, not just not just this kind of thing, but also social networking technologies. But activity and health is really the most important thing, I would say. There is a recognized syndrome of cognitive and memory loss called dementia syndrome of depression. And dementia syndrome of depression can mimic dementia in a severely depressed patient. Typically, when I say severely depressed, I mean someone who is so depressed that they are worn down physically, they have trouble getting out of bed. I'm not talking about someone who just has a little bit of sadness, all right? Typically, that is reversible with aggressive psychopharmacological and behavioral treatment focused on medications, kind of righting some of the cognition, but really focusing on activity as well. From a neuropsychological perspective, looking at the results of testing, they would look very, very different. So they wouldn't be mistaken by a professional, but they may look the same to a family member, particularly if the person has what we call a retarded depression that kind of reduces their overall motivation to do things in their activity level. So that's a separate syndrome, but I would say, just from my own clinical experience, that the majority of patients who have any one of these diagnosed dementia syndromes also have depressive symptoms that are probably worth managing directly